Good afternoon and welcome to this latest edition of the Elephant TV's conversations around the COVID-19 pandemic and its impact across Africa. And today it's my honor and pleasure to welcome Dr. Grieve Chelwa, who's originally is Zambian, and an economist. He's currently based at the University of Cape Town in South Africa. And today we'll be in conversation with him. Karibu sana, Grieve, welcome. And we're very, very grateful to be able to have you, for you to join us.
Thank you, John. I was going to attempt a response in Swahili. I've forgotten my Swahili, but I think I could respond by saying asante.
That works.
Thank you so much for having me.
Grieve. First of all, let me start by asking, we're in the middle of the coronavirus pandemic. How are you keeping? How's your family, both in South Africa and in Zambia? How are they coping? And I trust you're all well and fit and healthy.
I think, thanks, John, for that question. And I think it's frustrating for many of us. We had initially planned as a family, my wife and I had planned to take our newly born son. We've got a son who's turning 3 months old next week. Thank you so much. We had initially planned to take him to go meet his grandparents in Lusaka about now. But as you can imagine, the borders, South Africa is very strict about letting people out as well as letting people in. So we are stuck here, we're stuck here for a little while, and our son won't be able to meet his grandparents for a while to come. So that is a bit frustrating. But aside from that, we're managing. I think we have, accepted our fate that we have to stick indoors most of the time. As you know, South Africa's caseload is a bit high relative to the rest of the continent. So we're folks here a little bit more careful. And we're sticking indoors most of the time unless we need to go outside, which means I haven't been able to get a haircut in a while now.
We started doing these interviews in March, and I've seen men grow hairier and hairier.
That's true. That's true. But otherwise, we're doing well, John. I think we're doing well. My family in Zambia is also doing well. Fortunately, the caseload is lower there. And life seems to be proceeding relatively more normal than here. But they are doing well, yes.
Very glad to hear that. Grieve, let's launch into it. And I wanted to seek your opinion. I've read and watched some of your commentaries around the issue of development economics in particular. And I just wanted to get your opinion of the kind of impact that COVID has had on African economies and how that's going to roll out. But also, what opportunities have you seen for us as Africans to reimagine what economic development means for ordinary African citizens? I know these are issues that exercise you considerably, and I'll be very keen for your opinion in their regard.
Thanks, John. I mean, that's an important question. I think in terms of impact of COVID, I think initially when it became quite clear to the rest of the world that this was going to be a big issue around about February and March, I think around about February I think the expectation was, the prediction at least from a lot of experts, a lot of global health experts, was that the toll on Africa was going to be predominantly a health one. So that was a big expectation. I mean, so I think they were extrapolating from what they were seeing in Western Europe, in the United States, and they were saying, look, in these places with much better health infrastructure, much higher incomes, the toll has been a health one. We're also expecting and projecting that in Africa, the toll will also be a health one. And they had some very dire predictions, so there were some very dire predictions that were predicting 2 or 3 months hence, February. Yeah. I remember my own country the expectation was that by March, 10,000 Zambians would have died or something like that, right? And I imagine the same kind of predictions elsewhere. I mean, also, which is an interesting point itself, insofar as just the dangers of extrapolation and the dangers of, pontificating from afar, because many of these models that were doing these projections were based in, reputable places in the north. Yeah. But we now, what we now are seeing is that the toll is much more an economic one. in the African countries. It's much more an economic toll, and precisely because commerce has slowed down, right? So trade has slowed down, travel has slowed down. And one of the things that we did do in hindsight, which maybe might have been misguided as many African countries, we also copied and pasted a lot of the COVID coping mechanisms from the North. So at the time when the issue was big there was a lot of lockdowns. There were a lot of curfews, a lot of mandated stay indoors. And some of our African countries adopted some of that, and then that exacerbated sort of the economic issue even more. So, John, to answer your question, the impact in Africa, insofar as I see it, has been largely economic, precisely because commerce has slowed down. We can't sell, we rely on primary export commodities. We rely on people visiting us as tourists. We rely on these kinds of things. So this has slowed down, and this has primarily hit us quite badly, and hit us at a particularly bad time, when our economies were already slowing down. We're already in a very dismal state. So the impact has been primarily economic. Yeah.
Can I ask, there's been, one of the things that governments have done across the continent is implement these sort of COVID stimulus packages, the money, grants and money borrowed from, organizations, IMF, World Bank, African Development Bank, etc. At a time when across Africa, concern vis-a-vis debt, especially commercial debt, has been rising, particularly those countries that have borrowed heavily from the Eurobond markets and the Chinese state-owned banks for large-scale public works projects. And so that was being seen as a challenge that was on its way even last year. When we've seen meltdowns in places like Mozambique and Angola around this debt, how do you think sort of our debt profile across sub-Saharan Africa is likely to be impacted, exacerbated by this dramatic slowdown that you're describing?
I think it's going to make things worse. I think the expectation, and you're right, that coming into this year, there were already alarms about debt distress across much of the continent. We went on a borrowing spree, as you rightly put it. We did very well. Many African economies did very well towards the end of the first decade of this century, right? And then, some people had an idea to say, what, you guys are doing very well. Quite clear you will continue to do very well into the future. This is a good time to borrow, right? Go out and borrow, get some Euro bonds, take out some bonds, this kind of stuff. But obviously, again, the danger of very simple solutions, because those technocratic solutions are divorced from political realities, right? That if you're going to put billions of dollars into the hands of some of our policymakers, some of it will be spirited away. I don't need to tell this to John. John has spent his life fighting this kind of waste. So this was the idea that, you're doing very well, so you take out bonds. And many countries did take out bonds, right? Took out bonds for all sorts of things. They promised to do all sorts of things. And those things were hardly done. The understanding was that you take out this bond, you invest it in some particular type of activity. This activity would deliver a return that will allow you to pay back. So many of those loans and bonds are due now. They were projected to be due around about now. And lo and behold, COVID strikes. So what this means is that now our rate of income generation has slowed down. And in many cases, if the IMF's projections are to be believed, many of our economies are going to be in recession this year, which means they're going to shrink in size, right? Which makes the debt problem even worse. As you know, the way debt distress is calculated, we say the total debt that you owe, we divide it by the size of your economy. We get a number, and if that number is very high, that share is very high, we say you're debt distressed. So we're already debt distressed last year, but now our economies are going to shrink in size. So the denominator will get smaller, but the debt number doesn't shrink. So which means our debt distress problem is going to become even worse. So COVID really has made us almost we're almost at the edge, so it has made the situation much, much worse. It exacerbated an already bad situation.
Grieve, one of the things, just reading some of your work and your opinions, you focus quite a bit on the economics of health and education. in sub-Saharan Africa. And can you just share some of your insights of what this new normal that COVID has brought upon us is going to mean for those two very key sectors for developing countries like ours? Our health systems are under huge stress, and education has been disrupted. But we also, as the Singaporean said very early in February, that COVID will test our health systems, our governance systems, and our social capital. But now it's really the governance systems that seem to be facing the greatest stress. But from that perspective of your focus on health and education, can you just give us some of the insights of some of your insights in terms of the developments that you see taking place in those two particular very critical sectors for developing economies?
Thanks a lot, John. I mean, certainly my work in health and education, as often academics do, is very narrow in terms of its focus. But certainly some of the learnings from that narrow way can be generalized. I think the big problem about healthcare and education in many of our African countries has been sort of the rolling back of the state that came with structural adjustment. And I think that has always been the problem of healthcare and education. We underinvest in healthcare and education, be it actual material resources, money, in terms of number of people who work in terms of capacity. We've underinvested over the years in health and education. And I think for many people who were standing in February, I mean, I was not so much of a skeptic myself, because at the time I thought to myself, I'm not an epidemiologist, and I think my epidemiologist friends might be upset with me saying this, but it seemed to me at the time when I said, okay, this is an infectious disease.
Yes.
And the continent has had a history of dealing with infectious diseases. I mean, we are always dealing with malaria, always dealing with, all sorts of infectious diseases. So I thought we had some infrastructure, in inverted commas, to sort of deal with some of these things. So I thought we had already some infrastructure for testing and tracing and those kinds of things, and our own people's resilience, our own resilience of the health workers. We had, some skeleton laboratory facilities and so on and so forth. So I was very hopeful. I was placing my hope in that type of infrastructure. But in general, what is true is that we've underinvested as countries in health and education. And I think the big worry then was that if COVID does take its toll, I mean, it is quite difficult for healthcare infrastructure to cope. So I think, so when you ask the question about what opportunities does COVID have for us to reimagine a different kind of thing, and I think the issue here, and I hope it's an issue that's facing policymakers in health, for example, is to say, seems like we've been spared for now, thank God, but what can we do to improve our healthcare infrastructure? If anything, now many of our VIPs and the upper mwambas and the elites are being forced to go to these particular healthcare facilities that I'd forgotten about. So I think the issue is that we've eroded the infrastructure over the years, but this is an opportunity now, that we've been given room to pause to say, guess what? We have an infrastructure. It is in a bad shape. It's not entirely bad because we had, made some investments in the past, but this is an opportunity to do something about it. So this is how I would look at the problem, John. I think it's an issue of, an eroded infrastructure, eroded capacity, and I think this is an opportunity for us to do something about it. Yeah.
Thanks. I mean, I also wanted to ask Grieve, with the response to the COVID-19 pandemic, we saw China, whose role commercially, economically on the continent of Africa has risen exponentially over the past couple of decades. And we saw the Chinese, Mr. Jack Ma, Chinese billionaire, traveling the continent and distributing aid in terms of masks and PPE, these protective equipment, etc. And I wanted to seek your reflections of how you see this moment affecting this developing relationship between Africa and the East. China, India, and also Russia and Turkey, relationships that are deepening very quickly as those nations also grow and become more assertive economically, politically, just in terms of geopolitics. Everything is changing, and their presence in Africa is now a lot more profound than it was even just a decade ago.
Yeah, I mean, I think you're right that the COVID moment really gave China an opportunity in many ways to project its power across much of the world, and specifically in Africa, where China has been for the last, you're right, for the last couple of decades, especially over the last 2 decades, intensifying its presence. And you're right that, they took the opportunity. I mean, the West was on its knees at the time. In February, they were struggling. I mean, so all the big powers in the West were struggling. America continues to struggle, and China, which we know was the origin of the virus, seem to have had it under control, and seem to have figured out that one way is to break transmission is have masks, these kinds of things, make sure the healthcare workers have PPEs. So China took the opportunity to project its power, and I think you're right that so I think so in many ways, China projecting its power in the way it did this year was a sort of a natural logical consequence of what they've been doing already. Yes. They had already laid the groundwork. China seems to be very favorably viewed by many African presidents, many African governments, and it turns out by the typical African citizen. I've seen a lot of surveys, for example, opinion surveys that people tend to have a favorable view, general favorable view of China. So I think in many ways, this COVID moment with Jack Ma partnering with Ethiopian Airways and sending all these PPEs across the continent seem to have cemented that perception of China. So they took advantage of the situation, and I think, you'd be hard pressed to find anybody on the African continent, at least, who might have something unfavorable to say about China, specifically about what they did with spreading PPEs around, spreading test kits around, the things that were dearly needed at that moment. These things were dearly needed at that moment. Our usual friends who give us aid of that sort were facing their own problems, and China came in and stepped in and filled the gap. So I think that moment was really quite pivotal, and I think cemented this sort of benevolence that that the way we view China.
Though I would say I'm not sure that China is as popular in Zambia as it is in many where you originally come from, as a result of I know investments in the copper belt, etc. How is that relationship panning out?
That's true. Once in a while you tend to have sort of flare-ups, disagreements. Especially, I think there was one famous one where in a Chinese-owned mine, I think the Chinese owners used firearms against some workers who were demanding, extra pay and those kinds of things. And then this devolved into a fracas of some sort. But my sense, John, is that the typical person, and I think I have seen surveys for this. I think, I'm not so sure if this is covered in one of these, maybe Afrobarometer or somewhere there. But my sense is that the perception of China by the man and woman on the street tends to be generally favorable, especially when counterposed what we tend to see in the Western press. So this is, I think, what is striking for me. There are always going to be frictions, there are always going to be isolated instances of fights and these kinds of things. But my perception is that my sense is that the perception tends to be favorable. And I think one doesn't need to think hard to sort of try to explain why that might be the case. Our relationship with China now, I speak from Zambia's point of view, but I suspect this also holds for many other countries, has been one that appears beneficial. For the man or woman on the street, roads are popping up, hospitals are popping up. In Zambia, which is a very big footballing nation, where we really care about football and we are obsessed about football, the Chinese built 2 brand new stadia, state-of-the-art stadia that allowed us to host the Under-20 Africa Cup of Nations. It's a big deal. That gave us a go at hosting the Africa Cup itself. So I think for the man or woman on the street, they can see these things popping up around them, which are in many ways, in many ways a direct result of sort of this our interaction with China. So this is my sense. I think it's a very qualified statement about favorable perceptions given what you hear or given what you might expect. I mean, I'm surprised, right, that there's not much more friction, for example, between Zambians and Chinese, Kenyans and Chinese, that kind of stuff. So this is how I would read the situation. I mean, obviously there are points of disagreement. There are issues that are worrying about exploitation. There are issues that are worrying about how the Chinese might be in many ways subsidizing corruption or encouraging a culture of corruption. All these issues are there. But it seems to me that man or a woman on the street is either indifferent or on the margin rather favorable towards the Chinese. And I think it's there might be a whole historical story for this. I think for many people, this is the first time that interaction with outsiders in many ways is delivering these rather visible, in your face type of huge infrastructure projects, right? I mean, Zambia, they're everywhere, building roads, expanding hospitals. You know, one of our crown jewel hospitals is located in the capital city. It's named after an ex-president of ours, Levi Mwanawasa, and the Chinese are expanding this hospital.
Yes.
You know, and the project is right just outside, you know, right outside one of our biggest highways, so you can see it. Yes. You can see the Chinese, you know, poster signs there, and it's a huge kind of stuff. So this is my reading of how the man or woman on the street perceives our interaction with the Chinese. Yeah.
Countries such as the UK, France, etc., countries in Portugal, countries that colonized a lot of Africa. As you said, they've been going through their own challenges. But I wanted to just to seek your opinion on the impact of Brexit in terms of not only in terms of the geopolitics, but also in terms of economics. You know, given what you've just contextualized is African attitude. First of all, the Chinese coming in a very big way across Africa, but also African attitudes towards the Chinese. And as we go into Brexit, with Britain, which has been an important partner to many African countries, especially its former colonies in the Commonwealth.
You're right. I think, I mean, so there are many layers to this discussion. I think the first part is to figure out for the man or woman on the street, how present has Britain been in their lives? I think for many of us, aside from especially British ex-colonies, aside from leaving us with, you know, English, and aside from leaving us with curriculum that's heavily British-centric, I think Britain has been pretty much absent. I mean, my grandmother, in the village there, Britain has been completely absent. If I ask my grandmother about Britain, she would tell me a story about the last colonial governor, you know, who left just after independence. So Britain has been very absent. And in contrast to the Chinese, like I keep saying, my grandmother's village has a road, a real big road that the Chinese have built that connects the village to the capital city. A massive highway, well lit, you know, safe, you know, those kinds of things. So I think from that point of view, for my grandmother, Brexit means really nothing. I mean, she's indifferent towards it. But at the level of the economy, right, and this is an important question, at the level of the economy, one way to sort of respond to this question is to figure out how much of Africa's trade is with Britain, right? How important is Britain as a market for African countries in general? And when one looks at that data, you find that it is very insignificant. Britain is not so important for trade versus China, for example, and even surprisingly, the US. I was very surprised to find out the US is an important trading partner for Africa, not so much Britain. For investments, for foreign direct investments into Africa, Britain is marginal. So, I mean, very marginal from that point of view. In comparison to the Chinese, as you know, they're investing a lot in natural resources and those kinds of things, as opposed to the Americans. So from that point, from an economics point of view, Britain really is not so important. I mean, Britain is important to the extent that it's part of the EU, at least insofar as Africa's trade position is concerned. But once Britain is on its own, it's not so important on average. I mean, it might be important for individual countries. I know, like in Kenya's case, there are some Kenyan flour exporters who might have a very big market in Britain, but these are very marginal, isolated cases. In general, Britain is not so important. This is why I was not surprised to see the immediate past prime minister. Was she immediate? Sorry, her name was May. I think she went around.
Theresa May.
Yes, Theresa May. Yes, she went around at some point just before she stepped down, and she went around on some sort of a tour to try and encourage much more, cooperation, especially economically, between Britain and the continent. But I think that time is gone. I think there was a time for that before independence when Britain was entirely important. But now that time is gone. I think that space has been filled up by the Chinese. Because there's many of them, over 1 billion of them. They are growing as an economy, and as an economy that's growing, they need the stuff that we export. They need primary export commodities to power that growth, right? So, whereas Britain, I think I don't know what Britain's population is, but I imagine it's less than 100 million or thereabouts. So that's I think that's the issue here. I mean, it's sort of like at the level of the economy, Brexit is really neither here nor there kind of thing for us. I mean, it's not very important.
Let me ask you a question that allows for you to educate me and to educate our viewers, because one of the areas that you are focused on, Grieve, is the epistemology of development economics. What does development economics actually mean, and what actually works? And I've been fascinated by some of your reading, because you've questioned some of the orthodoxies that have prevailed for quite some time now. And I was wondering whether you can just break it down for the layperson, in terms of across Africa. I think sure Zambia is the same as Kenya. There was a time when you looked at cabinet ministries in African countries, there were sometimes 1, 2, sometimes up to 5 or 6 that have the word development in the Ministry of Agriculture, Agricultural Development, Economic. This is what really is one of the primary deliverables of any government in a developing country. But you've had some fairly clear opinions about the very meaning of development in this day and age, and perhaps some orthodoxies which are deserving of challenge as at this point in the 21st century.
Yeah, that's an important question, John. And you're right. This is a question that has sort of occupied my mind for a while. And I think when most people think about, a lay person, tell a lay person I'm a development economist. I think for them, the automatic sort of interpretation is that you are doing work that's going to lead to, once when you do your scholarly work, we'll then be able to understand what does Kenya need to do to transformatively develop, which is to say, to raise the incomes of Kenyan households, right? To change sort of like the circumstances of Kenyan households, to completely transform, to sort of say, to transform Kenyan households in the way that South Korean households have been transformed over the last 60 or 70 years. The old stories about how South Korea was a really poor place, in the run up to the 60s. And then now it's part of the OECD. It's a very wealthy nation. So this is what I believe most lay people, would, how they would interpret, the phrase development economics. This is how I interpreted it when I came into studying it. Yes. But when I entered this kind of scholarly stuff, I found it was completely different. I think the focus is very much on very narrow technical issues about, we're trying to evaluate whether giving, sort of asking obvious questions, whether giving iodized salt to children improves outcomes, whether giving mosquito-treated bed nets leads to better outcomes, whether deworming children results in better outcomes. These kinds of very narrow things, which are important. I mean, it's important, and some people will say they're obvious things you should be doing. You should be deworming children. You should be giving mosquito-treated insecticide, mosquito-treated nets, and those kinds of things. But this is what I found the discipline is very obsessed about. Very, very narrow types of inquiries that I think do not shed light on this rather big issue, this bigger issue of transformative development. This thing that I say when I say to John, I am trying to study development. John is going to say to me, Grieve, you're trying to shed light on what we need to do as a society to permanently raise our incomes so that our people's lives, our people's experience of life is improved. That is not exactly what this discipline is doing. According to me, I think to my mind, this discipline is really focusing the lampshade or focusing the light on the wrong issue. And in the process, wasting intellectual resources, wasting energies, and those kinds of things. In fact, interestingly, development economics as a field never looked like this in the 50s, 60s, and 70s.
Yes.
So in the 50s, 60s, and 70s, the development economists of that era were really focused on these things that I talked about how do you permanently transform societies. I mean, they use words like how do you permanently transform backward societies. So that was the vogue term then, referring to underdeveloped places as backward societies.
Yes.
But this was the focus. How do you, on a large scale level,
yes,
permanently drive development? And for them, the vehicle to do that was industrialization. That was a big debate then. So industrialization allows you to power your development processes, to permanently increase incomes and transform people's livelihoods. That was the vehicle through which you are supposed to receive this development. But the contemporary development economists are really their vehicle. I mean, they don't say this, so this is what's strange. They call it development economics, but when you confront them and you say, so is this going to lead to development? I mean, they might say, no, maybe not. I don't know what they would say. But the contemporary development economists, they are focused on these very narrow things, which to my mind are obvious, are things that ought to be done anyway. But, so this is, I hope I've been able to, distill this thing in some detail, but this is essentially the essence of the debate.
Yes.
This is what, yeah.
What would you say should be the critical elements? As I said, there are all these things that should be done as part of the course, deworming of kids, proper education system. What should development economics look like for Africa, given our very particular context? And also taking into account that, several countries, even though we have regional economic blocks, what should be the primary sort of the pillars of a development economic, the development economic program for African countries that is designed for our particular reality?
That's a good question, John. And I think the challenge is to, African economists to lend their minds to this issue. I mean, for me, it's rather tempting when I look at history, for example. And I think, one of my intellectual heroes, the Malawian economist, sadly died this year. His name is Tandika Mkandawire.
Correct.
Yes, exactly. So for him and his generation, having read history, for them, I think the conclusion was that, it's very difficult to find places in this world that have developed in the way that we think development is, this transforming people's lives, raising incomes, there are very few places in this world historically that have developed without having to industrialize. And in fact, Africa's immediate post-independence history. So if I look at the model independence year of 1960, in the 1960s, where many African countries got independence, a decade or so into independence, one tends to find a lot of income growth. There's a lot of income growth, and with that came a lot of social expenditure, social spending on healthcare, education. Many of us are beneficiaries of that. Many of our institutions that are still existing, many of our healthcare facilities, much of our road infrastructure was laid up in that period. And that period was a moment intellectually where many African policymakers and many African governments were convinced that industrialization was the way to get the job done. And for a while it worked. And then obviously there were some crises that happened globally, also crises that happened internally, and this process was short-circuited. So I think for me, I mean, obviously, when I read history and when I read the work of people like Thandika Mkandawire, when I read the work of, the very famous South Korean economist Ha Jung Chang, who studied the Korean miracle in much detail, I mean, I'm convinced that industrialization is, an industrialization-based development strategy is the way to go. But obviously in that, we need to find a space for agriculture, we need to find a space for all these other things. But I think the important point is sort of not to say what should we do to develop now, but I think the important point is to say this focus on very narrow, obvious things is distracting us from applying our minds at the much more important and urgent question of we need to develop, right? I mean, is it Julius Nyerere who said, the former president of Tanzania, he said, we need to run while others walk. I think Nyerere's comments are still very much relevant today. We need to run while others walk. And I think focusing on deworming tablets, focusing on iodized salt and mosquito bed nets and teaching girls negotiation skills, these things are important, incredibly important. We ought to be doing them anyway, but they're not the ones that are going to make us run. And I think we need to be applying our minds, particularly to that issue. I mean, so this is the essence of the critique, I think. The essence of the critique.
Thank you. Thank you, Grieve. You'll be surprised how quickly time flies.
Oh.
And I wish we had. It looks as if we're going to have to invite you again, because I do think it's important for us to drill a bit deeper into this whole the whole epistemology of development economics, and I think COVID provides a tremendous opportunity because a lot is being rethought by policymakers. Models are being thrown out of the window, and as you said, we have certain realities that China is here to stay, and Africans are responding quite positively to their space here, with a few bumps along the way. So I wanted to take this opportunity to say thank you very much for your time, and that we will be coming back to you, for a deeper chat, just on the epistemology of development economics as it's unfolding, and as people look for new models going forward. Thank you very much, Dr. Grieve Chelwa, who is Zambian but based in South Africa, an economist at the University of Cape Town. Thank you very much for joining the Elephant this afternoon.
John, it's been a pleasure, and I'm certainly available to talk more. These are very important conversations. Yeah.
Thank you very much, Grieve.